My name is Dr. Abhi Jayawant. I'm a clinical neuropsychologist and assistant professor at Weill Cornell Medicine, and I'm a researcher in the departments of psychiatry and rehabilitation medicine. Study that we developed is evaluating an intervention that we think might have the potential to improve symptoms of a stroke. When someone has a stroke, their thinking skills, what we sometimes refer to as their cognition or their cognitive function, can often be affected. So after a stroke, people can struggle to focus for long periods of time, to multitask, to keep track of a lot of information at once, and to remember information that's important for their day-to-day function. At the same time, a stroke can also impact a person's mood and how they feel. So often after a stroke, people can experience sadness, isolation, feelings of helplessness, negative thoughts about themselves and their self-esteem. The intervention is a mobile iPad-based cognitive training video game. So it's a game that you would play on the iPad. It takes place over 12 weeks with 4 in-person visits. As part of these visits, you'll complete paper and pencil assessments, and iPad assessments of your thinking, mood, your everyday functioning, trying to get a sense of these different symptoms that I described. You'll also complete 2 MRIs. We can arrange for travel and transport if you happen to be coming to us from the greater New York City area. We loan you an iPad with those cognitive games loaded on it so that you can play on your own at home during the week. You'll also meet with a clinician over Zoom, and this clinician will go over different strategies that might be helpful to you in terms of how your thinking and your mood might affect your daily life. Our study is open to adults between the age of 50 to 79 who've had a stroke at least 6 months ago and are experiencing difficulties in their thinking and their mood. Because the cognitive training games are played on an iPad, our participants have to be able to hold an iPad with both hands. Many trials and studies for stroke focus on medical treatments like medications or other types of treatments and interventions that address movement, motor function, and speech. And so thinking skills, cognition, mood is a relatively neglected area of stroke research. And so we're focusing on an area that often really matters to people who've had a stroke.